of a 21-year-old just came into the hospital.
She presented with headache, fever, vomiting, nausea, chest pain.
We think it could be a virus.
What are you bothering me for? Go treat her for it.
Alright, here's your antiviral drugs. We're going to take some blood for testing. Alright.
So how are you feeling this morning?
Spiders! The spider, get them off of me!
Help! Come help, we need help in here. Now she's presenting with behavioral changes and hallucinations.
What could cause all of these?
We're thinking that it could still be the virus acting on her.
But she's not responding to treatments.
True.
Maybe carbon monoxide poisoning.
Y'all should go check her house for any gas leaks.
Okay.
Carbon monoxide levels are off the charts in here.
Yeah. CO poisoning, alright.
We better be quick. Gas oven. Looks like she's got an appliance leak.
House. I found the source of carbon monoxide in her house.
Carbon monoxide competes with oxygen to bind hemoglobin, which causes the heart to beat faster and can cause chest pain because it's working harder to pump blood throughout the body to give it more oxygen.
That also goes along with the weakness and fatigue she has because oxygen acts as the final electron acceptor in the electron transport chain, and carbon monoxide also binds to cytochrome C in the electron transport chain, so she's not making any ATP.
And the behavioral changes can be explained due to the lack of oxygen to the basal ganglia. And basal ganglia have a high O2 requirement, which affects control of behavior. Also, carbon monoxide causes vasodilation, which can explain the headaches, and nausea and vomiting due to hypoxia.
Yeah, and also her test showed only a 40% carboxyhemoglobin level, which is not lethal.
Okay, y'all go treat her in the hyperbaric chamber for 30 minutes.
Okay.
We found out what's wrong with you. You have carbon monoxide poisoning. We're going to treat you with high pressure oxygen for the next 30 minutes. You'll be fine. You just need to get a carbon monoxide detector.
Here's more information on carbon monoxide and carbon monoxide poisoning. Carbon monoxide is a colorless, odorless gas, accounting for the most deaths due to accidental poisoning each year. Deaths occur due to hypoxia and tissue damage. This is because carbon monoxide competes with oxygen to bind to hemoglobin, and carbon monoxide's affinity for hemoglobin is 200 to 250 times greater than oxygen. This is an oxygen-hemoglobin dissociation curve showing O2% saturation with no hemoglobin bound to carbon monoxide and 50% hemoglobin bound to carbon monoxide. With 50% binding of hemoglobin to CO, there's less O2 saturation, and even at high partial pressures of O2 saturation, poisoning is deadly. Carbon monoxide levels are measured in the body by taking blood samples and testing for the amount of carboxyhemoglobin. The half-life of carboxyhemoglobin is 4 to 6 hours in normal air, which is why the patient continued to show symptoms after being admitted to the hospital. The hyperbaric oxygen treatment, which exposes patients to high-pressure oxygen, decreased the half-life of carboxyhemoglobin to 15 to 30 minutes.
The hospital.
She presented with...
We can do this.
House. I found the source of leakage.
Hey, memento.
Carbon monoxide also causes vasodilation.
Just a door with voices. Did she really go all the way down? Oh, sorry, I ruined it.
Looks like she's got an appliance in